Okay, come on in. Are you here for the 3 o'clock appointment? Okay, awesome. Have you ever been with us before? No, this is your first time. Okay, well, it's great to have you. I might as well explain to you what your experience is going to be like today, because it's probably going to be a little bit different than what you're used to going to most doctors' offices. Basically, we're trying to make this the most relaxing experience for you that we possibly can. So we only take 5 patients every single day so that we can maximize our efforts at making their experience relaxing and peaceful, to address every single concern and question that they may have. So you are our 5th and final patient of the day. And yes, so things are going to be a little bit different than your typical appointment, in that it's going to be thorough and relaxing, and you get the picture, right? Okay, so sit down, make yourself comfortable, and before we get started, would you like me to make you a nice cup of tea? Awesome. Okay, then let me do that for you, and then we will start with filling out your paperwork, which I will be doing for you, so you don't have to worry about asking me questions or taking care of that yourself. Yeah, that's always a pain. Okay, allow me to make your tea, and I'll be right back. now that you have your tea, we can get started on that paperwork. So, will you just give me your first and last name? Thank you. Give me your date of birth, please. Great. Right, and will you give me your home address? Perfect, thank you. And the best phone number to reach you by? Okay. Now, I'm just going to get into some questions about family history. So, do you have any family history of high cholesterol? Okay. How about high blood pressure? Any sort of heart issues, stroke, cardiac arrest, heart attack? Okay. Any history of cancer on any side of your family? Okay. Family history, anyone with diabetes? Okay. Now, do you have any health issues that you want to talk to us today, specifically? Health issues. Okay. Yeah, we can get that checked out for you. And the goal of today, what is your goal for the day? Any questions you would like asked, or just this one issue looked at? Okay, just a normal checkup. Okay. Do you have any issues sleeping? Do you have any headaches or migraines? Okay. Do you suffer with stomach aches, indigestion at all? Okay. How about your mental health? Do you have any anxiety or depression that's ever been diagnosed before? Are you currently on any medication for anxiety or depression? Okay. Any other struggles mentally, OCD, memory issues, anything of the sort that we should know about? A little bit of brain fog. Okay. Alright, and now, how often per week do you exercise? Okay. What does your diet look like? Yeah, it's kind of an open-ended question, but are you on any diet currently, or are you trying to lose weight? Okay. Overall, how would you rate your satisfaction with your health in regards to your fitness, your cardiovascular health? How do you feel out of 10, if you could give me a number? Okay. And how do you think that we can help you with that today, or can we help you with that today? Okay. Just like to ask. Okay, Okay, and just a few more questions. Have you had any major surgeries recently in the past 12 months? Are you on any form of medication currently? And what are those medications? Okay. Thank you. Alright, that is it for the questions. The doctor will be with you very shortly, so if you could just sit there, relax. If you need anything, just come and ask me, okay? Okay. Hi. It's very nice to meet you. I am Dr. Olzye, and I'm going to be taking care of you. How are you doing? Okay, well, I have paperwork here in front of me. I just want to take a quick look at that you filled out with the receptionist outside. Everything looks good. Okay, so you had a question about the bump on the side of your head. I'll definitely take a look at that. But we're just doing an annual checkup on some things, is that right? Okay. Well, that sounds great. Just want to reiterate what the receptionist, I'm sure, told you. We want this experience to be as relaxing as possible. So, I want you to feel comfortable to ask me any questions. I want to be able to take the time to really answer them and get to know you. I don't want this to be a stressful situation, as oftentimes doctor visits can be. So, yeah, we're just going to take our time. We're going to hopefully have some fun. Going to the doctor can be fun. And, yeah, we'll get everything checked out and send you on your way shortly. Okay. Okay, so the first thing that I'm going to do is just I'm going to take your pulse, look at some of your vitals. So, I'm going to ask you to just sit still for me. I'm going to check your heart. Okay. Good. Do you have a slight heart murmur? Okay. Yeah, oh no, it's nothing serious. Just a little bit hard to pick up. Okay. Now I'm going... Okay, good. Now I'm just going to come around the side and ask you to breathe normally for me. I'm going to check your respiration. Hold on a second, get this side. Just breathe normally for me. Okay, and now take in a really deep breath. Okay. Come on the other side. Just take in a deep breath for me. And hold and exhale. Good. Now a couple of just normal breaths. Good. Nice. Okay. Everything's good there. Now, just going to take your hand and feel your pulse. Get a stopwatch. Just gonna see how many beats per minute. It's hand and start watch. Good. Okay, good. I was actually counting your respirations there. It's a little trick of the trade, just so you breathe normally. Alright, now I'm just going to test your sensation in your face. So I have a sharp side of the pencil and a dull side of the pencil. I'm going to just lightly touch you with either side, and I want you to close your eyes and tell me which one I am doing. Okay, ready? And just, say sharp or dull. Good. Just a few more here. Excellent. Good. Now I'm just going to swab your face with this little cotton ball, and I want you to tell me when you feel something. If you do feel something, just say yes. Alright. Close your eyes. Good. Good job. Okay. Now I am just going to take a look at you and also take a look at that bump that you were telling me about. First, I'm just going to check your head and your hair. So right on the side here. Okay. Everything feels normal. A little. Yeah, that's nothing. Good. Mm-hmm. Okay. Back. Side. Just gonna check your hair now. Healthy scalp. I'm just going to use this to sort of help me part your hair and see if there's any moles or bumps or scabs, rashes that we need to be aware of. Good. Don't have any dandruff. Excellent. Everything looks healthy. Good. Great. Right. Next thing I'm going to do is just check some of your face movements. So I'm going to ask you to do a couple of them with me. The first, just raise your eyebrows, crinkle your forehead. Good. Keep it up. Mm-hmm. Alright. And now, can you shut your eyes for me? Close them really, really tight. Mm-hmm. Keep them just like that. And I'm going to try to open them, but try to keep them closed, okay? Good. Excellent. And now try to open your eyes really wide. Don't think so much about raising your forehead, just open your eyes really wide. Okay. Okay. Now can you smile for me? Puff out your cheeks. Okay, do that one again. Okay. Nice. And now just open your mouth as wide as you can. Okay. Good. Keep it open. Just gonna check that. Okay, I'm just gonna ask you to open and close your jaw, and I'm just gonna feel. So you open and close. Good. Just feel underneath as you open, close. Okay, good. Now I'm going to check your hearing. So I'm just going to be doing this in your ears. One ear at a time. Just going to ask you to tell me when you don't hear that sound anymore. Okay. The other ear. Okay. Okay. Right ear. Sorry, your left ear. Okay. Okay. Great. And go. Okay. Excellent. Now I'm just going to inspect your ear a little. See if there's any irritation, wax buildup. That ear looks fine. Okay, just come around to the other side. Check this one. See if there's any irritation or buildup or anything of the sort. Looks good. Okay. Any tenderness, soreness? No. Okay. Excellent. Now I'm just going to take a look at your eyes. So I'm just going to pull down the lower lid a little bit. Check. Do you experience any dryness or irritation in your eyes? Do you wear reading glasses? Okay. Just checking to see. Great. Eyes are looking good. Right now I'm going to ask you to do a couple of visual exercises. So I'm going to ask you to keep your head focused on me. Your head, okay, don't move your head, but follow your finger with your eyes, okay? Ready? Okay, and I'm going to do that a couple of times, just coming in close and away, close and away. Now we're going to switch hands, close and away. Okay, now I'm going to ask you to focus on the finger and then focus on the wall behind me. Okay? So my finger, wall, finger, wall, finger, wall. Good. Now I'm going to ask you to tell me when you see my fingers come into your peripheral. I'm going to be wiggling them. Okay. Again. Doing good. Okay, excellent. Now I'm just going to check your pupil dilation coming in from the side. Okay. Good. The other side. Right. Sorry, I know it's a little bright. Okay, we're good. Now I'm going to just check your tear glands. Good. Excellent. And while I'm at that, I'm going to check your sinuses. So tell me if you feel any pressure, discomfort, but breathe normally. Okay, there. Okay. Good. And now we're going to do the fun part. I'm going to test some smells with you. So I have a secret smell here. And don't look. I'm going to take off the lid and ask you to identify the smell. Okay, you ready? Good. Coffee. Excellent. And this next one. Top's going to be a little bit. Okay. Vanilla. Good. Try this. Peppermint. Excellent. And one more. Cinnamon. Good. That one tends to be pretty easy to recognize. Great. I'm just going to examine your nose, if I may. Let me just shine a light. Check. Okay, and close off one nostril for me and try to breathe normally. And the other. Okay, good. Do you snore at night? Do you know? Okay. Right. Now I'm just going to ask to open your mouth for me. Just examine, say ah for me. Okay. Just look in there and sorry, I need my flashlight again. Okay, the back looks good as well. Right. Just there. Neck. Alright. Good. Everything is looking great. Do you have any more questions for me? Are you sure? Yeah. Because, like the receptionist said, we really want to take our time and make sure we answer every question and make you feel comfortable. Okay, you're good. Alright, if you're good, I'm good. Thank you for coming in today. I hope that your experience was relaxing. If it was, you can leave us a review online and say it was, and if it wasn't, then you can leave a review online and say it wasn't. But either way, we are so glad to have you in our office today, and hope to see you again in a year, I guess.